You've probably heard a ton about artificial intelligence changing, well, pretty much everything. But what really happens when you apply that same powerful technology to something as personal, as hands-on as wound care? Today, we're going to dive into the incredible potential of AI to support our clinicians, but we're also going to get real about the challenges of bringing this tool to the patient's bedside.
And look, the stakes here are just incredibly high. This isn't some abstract number. 18 million, that's the projected global shortage of healthcare professionals by the year 2030. That is a massive gap between the care people need and the experts available to give it. So it really makes you ask, right, how can we possibly do more with less? And that's exactly where the search for smarter solutions has to begin.
And you better believe the money is following. The investment pouring into healthcare AI is set to absolutely explode, from just over $11 billion in 2023 to a mind-blowing $427 billion by 2032. This isn't just a gamble. It's a huge bet that AI is a critical part of the answer to closing that 18 million person gap we were just talking about. So, you've got this massive provider shortage on one hand, and on the other, demand is just exploding. Our population is aging, and we're seeing rising rates of conditions like obesity and diabetes. That means more people with more complex wounds that need specialized care. You can literally see the system straining at the seams. Okay, but before we all get scared off by the term AI, just take a look at this quote. This is from the very proposal that actually coined the term way back in 1956. The basic idea here is actually super simple and has been around for a long, long time. If a task can be broken down into logical steps, a machine can be taught to do it. It's not some kind of dark art. It's just logic.
And the funny thing is, you're already using AI all day, every day. I mean, think about it. You use a search engine, you get shopping recommendations, maybe you talk to a digital assistant. Heck, maybe you even have a robot vacuum cleaner bumping around your house. All of that is powered by complex AI. And that's exactly the kind of seamless, helpful experience we're aiming for in healthcare. All right, so that's the big picture. But what are the actual tools in the AI toolbox? Let's pop the hood for a second and break down some of that jargon you always hear into concepts that actually make sense.
First up, the big one, artificial intelligence itself. The best way to think of AI is as the whole field, right? The big umbrella term. The entire goal is to build systems that can do things we normally associate with human brains, like learning, solving problems, making decisions, but with the insane speed and power that only a machine can bring to the table.
Okay, so hiding under that big AI umbrella is machine learning, or ML. And this is where things get really clever. See, instead of programming a computer with a rule for every single scenario, you just feed it a ton of data and let it figure out the patterns for itself. It's like showing a toddler thousands of pictures of a cat until eventually it can spot a cat it's never seen before. It's literally learning from experience, just way, way faster.
And if we go one level deeper, we hit deep learning. Think of this as machine learning on steroids. It uses these really complex structures called neural networks, and these are modeled, believe it or not, on the actual network of neurons in our own brains. This layered approach is what allows an AI to spot incredibly subtle patterns, like the difference between healthy and unhealthy tissue in a photo of a wound. Last but not least in our toolbox is natural language processing, or NLP. This is the magic that lets a computer actually understand human language. Just think of all that critical information that's locked away in doctors' handwritten notes or buried in dense research articles. NLP is basically the universal translator that can unlock all that data and make it useful.
Okay, so we've seen the tools. Now for the fun part. How are they actually being put to work in the clinic? Because this isn't science fiction, this is happening right now.
Check out this super practical example. A clinician snaps a quick picture of a wound with just a regular smartphone. And right away, the AI gets to work. It figures out the exact boundary, it breaks down the different tissue types inside the wound, and it spits out measurable, objective data. What was once a subjective eyeball test suddenly becomes hard data you can track over time. That's a game changer. And hey, this isn't just happening in wound care. AI is showing up all over healthcare. I mean, it's helping radiologists spot cancer way earlier, it's personalizing treatments, it's even helping to create super realistic training simulations for new doctors. This isn't some niche experiment, it's becoming a foundational technology. But of course, all this amazing potential doesn't mean it's a walk in the park. Getting this tech from the lab to the clinic is a journey filled with huge roadblocks that we absolutely have to tackle head-on.
All right, first up is a really tricky one. It's called the black box problem.
Sometimes, these deep learning models can give you the right answer, but nobody, not even the people who built them, can fully explain how it got there. Now, put yourself in a doctor's shoes. If this AI tool spits out a recommendation, but you have no idea why, how can you possibly trust it with a patient's life? It's a massive hurdle.
Okay, this next one is absolutely critical. An AI is only as smart as the data you feed it. So if you train an algorithm mostly on pictures of wounds on light skin, it's going to be way less accurate for patients with dark skin. That doesn't just make the tool less effective, it actually risks making healthcare less fair. It could widen the very gaps we're trying to close.
And then you have this really weird problem they're called AI hallucinations. This is when an AI generates an answer that sounds completely confident, totally plausible, and is 100% wrong. Now, it's one thing if your homework helper AI makes up a historical fact. Annoying, but whatever. But in a hospital, a hallucination could be a fatal misdiagnosis. The stakes are completely different.
And as if that weren't enough, there's a whole laundry list of other issues. Making sure patient data is secure, trying to plug shiny new AI into creaky old hospital IT systems, earning the trust of skeptical clinicians, navigating a maze of regulations, and of course, who's going to pay for all this? So, with all these massive roadblocks, how do we ever move forward? Well, the answer isn't just better code. It's about shifting how we think about this whole thing. AI isn't here to replace clinicians. It's here to be their partner, a powerful co-pilot.
There's this myth that clinicians can't help build AI because they think clinically, not computationally. That could not be more wrong. The truth is that clinical thinking is the single most important ingredient. Without that real-world, practical wisdom, an AI tool is just a fancy piece of code floating in space. It's totally useless for actual patient care.
The reality is, clinicians are absolutely essential at every single stage. They're the ones in the trenches who know the real problems that need solving. They're the ones who use their years of experience to validate the results and say, yeah, that actually makes sense. They test it, they give feedback, they monitor it. At every single step, the human expert is the pilot, not the passenger.
And this right here is what that partnership looks like in the real world. Look at what clinicians are actually asking for. It's not some robot doctor to take their jobs. It's smart, practical tools to fix the annoying, everyday problems. Tools that help different teams talk to each other, help patients manage their own care, and of course, keep data safe.
And that really brings us to the final, and maybe most important point. An AI can crunch data like nothing else. It can spot patterns a human would never see. But can it offer empathy? Can it hold a patient's hand? Maybe the true promise of AI isn't about replacing humans, but about freeing them. By handling the data and the busy work, it gives our amazing clinicians more time to do the one thing a machine never, ever will: to care.